Good morning, my YouTube viewers. That's Palestine. I wanted to make another video for you. Basically, this is going to be a cancer-related topic, but it's a very serious topic because I have a friend who has a mental illness. She has schizoaffective disorder, and schizoaffective disorder is like schizophrenia and bipolar on a spectrum, and she has to take clozapine, and clozapine is for treatment, or it's the last course of action for schizophrenia. It's basically for treatment resistant schizophrenia, and clozapine is a very dangerous drug. It's so dangerous that it can give you a type of blood poisoning. So if you're taking clozapine, then you have to go to a clozapine clinic, and they have to take your blood every month to make sure that you don't have blood poisoning. And another thing about psychiatric medications is they can give you like something called a syndrome X, where you have all your fat around the middle. And so this friend of mine, she's got skinny arms and legs, but she's got all her fat around the middle. Well, this friend of mine, she takes her psychiatric medication because she's required to, and she takes her diabetic medication as well, but she still eats lots of sugar and sweets and things like that, which she shouldn't be doing if she's diabetic. But having said that, I don't think that her diabetes is as bad as mine. She also lives in something called supported housing. Okay, and then basically what happens is, if your mental health is in such a bad condition that you can't live on your own, then what they will do is they will put you in supported housing. So she is in supported housing because her mental health is so bad that she cannot live on her own. And there are people that work in this supported housing, like support workers and nurses and social workers and things like that. Well, this friend of mine, one, she is being financially exploited by people, and she told me that she had to speak to a social worker, and the social worker told her that she needed to learn to budget her money, which she doesn't do. And I don't want to talk too much about this friend's personal situation other than just to say what is pertinent for this video. Well, this friend, she's got terrible teeth. Teeth are in awful condition. She needs to get dentures, but she won't go to the dentist. And the reason why is because she won't have her bad teeth extracted. So her teeth are terrible too. She won't do that. And the thing is, since her teeth are so close to her brain, I'm sure that her poor dental health is affecting her brain on top of everything else. And then she got a letter saying she had to go to a mammogram, and now she's saying she doesn't want to go to a mammogram. Well, one, she's obese, so obesity can cause breast cancer. Two, she takes psychiatric medications, so psychiatric medications can cause breast cancer. And three, she's diabetic, and diabetes can cause breast cancer. And so she's saying she doesn't want to attend the mammogram. And there was even this nurse where she lives that told her she didn't have to go to her appointment. And I'm really angry about that, because a nurse should not be telling her that she does not have to go to her appointment. So I told this friend I would go with her to the appointment, which means I get off at 1:30, so I'd have to get off work, walk over to her house, pick her up, and then walk back to the hospital to take her to the hospital. But I would do that. I would do that for her to make her go to her appointment. Now, she asked me what did this mammogram entailed, and I explained to her what they did, and she started frowning and saying she didn't like that and she didn't want to go. And I told her, I was very clear with her. I told her, I said, if you have breast cancer and you don't do anything about it, you will not stay alive. And I used more graphic words than that, than what I'm using on YouTube because I don't want to get kicked off YouTube. So she knows what the consequences will be if she has breast cancer and she doesn't get treated for it. So I don't know what's going to happen about this. I will probably on December 3rd, I'll ring her up and say, are you going to the mammogram? Do you want me to come get you to take you? And I also told her that I thought her boyfriend should be taken to her to the mammogram because she's got a boyfriend who is exploiting her financially. And she said she doesn't want the boyfriend to take her. But on December 3rd, I'll ring her up. I'll say, are you going to the mammogram? Do you want me to come get you and take you to the mammogram? Well, my point here is, one, I'm upset that this nurse told her she didn't need to go when she's at very high risk of getting breast cancer. And two, I'm a little bit upset with her that she won't go to medical appointments that she needs to go to. I mean, ever since I've known her, her teeth have been in an appalling state. She won't get anything done with her teeth because she can't sit in a dentist chair. And now she doesn't want to go get a mammogram. So if she doesn't get the mammogram and she has breast cancer, well, you know what the outcome of that is going to be. Well, my question is, should women who are mentally ill, be required to get mammograms? And I think, yes, I think that she is mentally ill. She takes a handful of tablets every day, just like I do. She's living in supported housing. She has support workers there to give her support, although I don't think they're supporting her much because they're allowing her to be financially exploited and not forcing her to go on medical appointments. But I think that if a woman is in such poor medical condition that she has to live in supported housing and she is required to take psychiatric drugs, that she should be required to go to get a mammogram and be treated for breast cancer if necessary. And my friend told me, because when he told me that I have an autistic friend, he told me that if I refused to get treated for my breast cancer, they would section me. Well, why aren't they requiring my friend to get a mammogram and be treated for breast cancer? That's my question. They say that I looked it up on the internet, and the internet said that a mentally ill woman does not have to get a mammogram. But I think that this particular friend of mine, she's living in supported housing, which means she lacks capacity. I think she should be required to get a mammogram and treated for breast cancer if it turns out that she has breast cancer. So I would like to know your thoughts. What do you think? Do you think that mentally ill women should be required to get mammograms and they be escorted to those mammograms? I know I'm opening a can of worms, and according to Google, mentally ill women don't have to get mammograms. But I think if they have to take psychiatric medication, then they should be required to get mammograms as well. So that's what this video is about. Let me know what you think. Do you think that mentally ill women should be required to get mammograms? And I'll just leave it there. Thank you for watching my video. If you like my video, please like and subscribe, and I'll be making some more cancer-related videos for you soon.